Hello lovely people, welcome to my channel. And today the question is, do you know the rationale behind putting on pad on your head before carrying load? If yes, then you're almost through with today's discussion, and even if no, you too will get there. Let's start. The topic is osteoarthritis, and simply put, bone joint inflammation or pain or disease. As normal human beings, we all have bones, we all have our 360 joints. And talking about joints, what at all is joint? Joints is where two or more structures or parts meet. So where they meet is joints. And in joints, it's not made up of only bones. We have other components. We have cartilage, we have nerves, we have ligaments, we have synovium fluid, we have capsule, we have periarticular muscles. All is doing something there. The nerves is the nerve giving sensitivity, supplying nutrients. The cartilage is also as a defender. Remember the question I asked about the pad? Is there limiting weights, limiting shocks? Is there preventing friction of bones against bone? Because supposing you putting on weights in your joints and there is no cartilage to limit the gravity of that weight, that means it will get to your nerve, and that nerve is very sensitive. It's a very thin like thread, but it's also powerful over there. It will get to it and you feel pain. Yes, so in God's own wisdom, he made all things perfect. In a situation when you overuse your joints, you feel pain, but it's not because of that very day alone, huge load you carried, or you overstressed that very day alone, that caused the pain, but it's a gradual long time activities which is going on, causing deterioration or wearing away of your components, be it the cartilage, the synovium fluid, the nerves, being inflamed and has gotten to your bone, causing production of pain. That's how it is. But under normal circumstances, what happens is, whenever there is catabolic activities, there should be anabolic activities. I mean, in terms of catabolic activities, whilst you are using the cartilage and the components, there should be new production. That is the anabolic activity, new production of the cartilage and maintaining it for you to be using it. But if you let the catabolic activity or using it, making it being destroyed, become more than how it's being produced, you can still feel pain. Or if there is one or two things causing distraction, it can be your DNA not giving good information for the production. It can be that the components, we have components which will combine to form those cartilage. There's extracellular matrix, the glucosaminoglycans, the proteoglycans, the collagen, and so on and so forth. They come together to form new cartilage. But if they are not forming well, or abnormalities occur, then it means you won't have those new cells to replace the dead ones. But you too won't stop using your joints. You have to use them, and whilst you are using, there is no defenders, and it will be causing pain. If care is not taken, you'll be having a chronic pain. So that is how it is. Let's talk about some of the common joints. It can affect any joints, but there are some common joints which we normally see patients complaining. Most patients complain about some of the, like their finger, the proximal and the distal phalanges joints. Yes, the joints, the finger, we have some joints, the top and down here joints, they normally complain, and the thumb also joining to the palm joints here, they normally complain about. And when we get to the down, the hip joints, patients normally complain about the hip joint. They normally complain about their knee joint. They normally complain about the lower lumbar region. I'm talking about your spine, getting to your waist, lower there. People normally complain about it. And At the foot also, they complain about bone joint inflammation or disease can affect anybody, but there are some people who are of high risk than others. For instance, females normally put on shoe or high heel, which puts pressure on the affected joints, the hip, the knee, the foot joint, which will cause deterioration or degeneration of the joints, and at long run it will cause pain if they continuously use them. And most of the muscles and the fat also are accumulated at the hip side, which will put pressure on involving joints, and at the long run that one will also cause pain. Middle age, when I talk of middle age, range from, let's say, 40 to 60. It can even happen you are at your pension, like you are a pensioner and you will be experiencing pain whilst you are not working. Yes, it's not the very time, as I said, but it's a gradual, continuously, like progressively activity that has gone on, and now the results is showing as pain. So you will not be working, but still you'll be facing such pain, depending on the work you also do, like functional overload, your profession. If you are a sportsman, you'll be involving most of your joints, and at the long run you can also experience osteoarthritis and pain. Sure. Even if you are just sitting at office, you are an office worker, a banker, or any other work, if you do the same position for long, still you are stressing some joints. Yes, maybe the joints weren't mentioned, but as I said, we have 360 joints, so any joint is joint. So at the end of the day, long run you'll be experiencing pain. People are also born with it. We call them congenital defects. So it can be that they are not in their middle age, but they are experiencing such osteoarthritis or bone joints pain or inflammation. Yes, they have musculoskeletal disorder. That's the reason why. People with metabolic disorders like gout is also another medical condition. So gout patients will also be experiencing pain. Obesity, if you are also fat, you put more pressure on your joints because of the loaded fats, and you can also be experiencing pain. Genetic disorders also. There are some people who are genetically abnormal and they have high risk. Chronic hemarthrosis also. They are people who bleed in their joints, like chronic. They have chronic bleeding into their joints. It can be that they are hemophilia patients, like they have defects or lacking something in their blood clotting system, so they can also be of high risk. People with endocrine disorders like diabetes,